before we actually start and understand what is menopause, let's understand why menopause is so significant. So if you see this graph over here, it shows us the life expectancy and how it has increased over the last couple of decades. So in 1900s, people lived up to be 40 or 50, and that was a lot. Today, women and men both live up to maybe 90, even 100. But the age of menopause has stayed the same. That has not changed. So that means that a woman is spending almost one third of her life after menopause. So it's definitely important for us to understand menopause, to understand what happens in menopause, when does menopause happen, and so on. So that is why we all should know about menopause. And you all. So menopause is significant for women, yes, because every woman is going to go through menopause. But it's also important for men because every man has women in his life, and how that woman is affected by menopause definitely makes an impact on the whole family and on that man as well. So it's really important for all of us to know about this phase of life, which is menopause. Now, talking about the phases of life, the different phases of life that a woman undergoes right from the starting of her periods. So a girl starts her periods around maybe 12, 10 to 12 years of age, and then she goes on to have periods for the next 3 to 4 decades. And after that, at one point in time, she has menopause. But the transition from having regular periods up to actually being menopausal is this time period in between, which is called as perimenopause. Now, this perimenopause will see the beginning of certain symptoms that you see in menopause as well. And then menopause happens around the age of 45 to 50. And the rest of the life, that the one third of the life that we spoke of, is what that the woman is spending in post menopause. Now, what is exactly this menopause? When do we say menopause has happened? So suppose you've not had periods for 6 months, is that menopause? If you have not had periods for 2 years, is that menopause? So by definition, not having periods for 12 consecutive months is what is menopause. Now, why does menopause happen? So we are all born with, a finite number of eggs in our ovaries, and every month the ovaries are recruiting these eggs, developing follicles, and there's ovulation happening. So the whole cycle is incessantly working. Now finally, at around this age of 40 plus, around 50s, the ovary gets the ovarian supply of eggs gets exhausted, gets depleted, and that's when menopause strikes. So there are no eggs and no more eggs to be developed from the ovaries. The whole menstrual cycle gets disrupted. There are no periods, and then you reach menopause. But this whole uh, disruption of the cycle starts at perimenopause, when there are fewer eggs left, and the ovulation is erratic, and the level of the hormone estrogen goes down. Now, this hormone estrogen is what is secreted by these ovaries, and when that hormone estrogen goes down, that's when you start having all the symptoms of menopause. So when does menopause occur? That's the next question. And I think what is more important is also, when will I have my menopause? Yeah. So people are often, there's a myth around the timing of menopause. People feel कि हाँ वो तो 50s के बाद आता है, 60 के आसपास आता है. So unfortunately, menopause doesn't happen so late in a woman's life. The average age of menopause for Indian women is 46 years, and the worldwide average is around 48 to 51 years. So Indian women have their menopause earlier than their Western counterparts. Reasons we don't really know. It probably depends on the genetics that we Indians have, or it is probably something to do with the weather or with the climate of our country. We're not sure, but Indian women do have menopause a little earlier than their Western counterparts. And what does this depend on? This age. When will you have your menopause? It depends on when your mother has had her menopause, your mother or your maternal aunt, or maybe your elder sister, when she has had her menopause. That will also determine the age when you will have your menopause. It also depends on certain lifestyle factors, smoking as well. So if you're a smoker, you may have your menopause early, for example, and all of these things. There's also been a relation which has been shown to be there between, if you have an earlier menarche, or if you start your periods earlier, before the age of 11 years, you also may have an earlier menopause as well. So when I say you'll have menopause at this time, and your eggs are getting depleted, your ovarian hormone, the estrogen level is going low. Now the low levels of this hormone estrogen is what causes the symptoms of menopause. Now estrogen levels go down, eggs are depleted, periods stop ho gaye. So yeah, that is one of the external signs that we see of menopause. But menopause, unfortunately, affects us in a lot of ways. People feel that how menopause may serve, very commonly serve menopause. When I talk about menopause, people, the main difficulty or problem or worry that people have, oh, now will I gain weight? So yes, weight gain is one of the symptoms of menopause, but there are other symptoms of menopause as well. Now, why do these symptoms happen is because this hormone estrogen affects the human body or the female's body right from head to toe. It affects the working of our brain, it affects our skin, our hair, our heart health, our gut health, our bone health, our muscles, and so on. So with lower levels of estrogen, all of these the mechanisms get disturbed, and that's why we see all of these symptoms of menopause. So you get hot flashes happening at night and disturbing your sleep are called as night sweats. You have mood swings, anxiety, anger, irritability. You have a different fat distribution because of which you gain weight, especially around your waist. You have dry skin, you have vaginal dryness, you have hair loss, your bones are getting weaker, and you're having a sleepless nights, and so on. So all of these are the symptoms of menopause, which happen because the hormone estrogen is getting lower and lower when you are reaching menopause. So one of the very important symptoms of menopause and one of the very common symptoms of menopause that people feel is, mental health symptoms. And there is a myth that, mental health symptoms or depression has nothing to do with menopause. Your anger has nothing to do with menopause. But unfortunately, that is not true. So people or women who've had menopause have an increased incidence of having depression. So they are more prone to having depression because of the hormonal changes that are happening inside their bodies. So all of these mental health concerns are definitely more common around your menopause, and they are definitely related to menopause. Now, what is important here is that you should not brush these things away, saying, "Oh, she's aging, and it happens with age." It may happen with age. It does happen with menopause, but what is important is the kind of help you seek for that. So even if those symptoms may be happening because of menopause, there is help available. There are solutions available for most of them, which may range from lifestyle modifications up to some medications that you might need. So basically, there are solutions available, and it is important that you understand that these symptoms can be because of menopause, and that you try to solve them and try to find a solution for these symptoms. Now, going ahead, let's see the types of menopause. So menopause, like I said, you usually achieve a menopause around the age of 46 years. So depending on the timing of menopause, you can have either an early menopause or a late menopause or premature menopause. So when we say that menopause happens at the age of 46 years, at an average, two standard deviations aage piche is early and late menopause. So by that definition, less than 40 to 38 is the time of early menopause, and is the time of premature menopause, and around maybe between the age of 40 or 38 to 46 is the time of early menopause. Anytime anybody getting the menopause after 54 years of age is when we say they have a late menopause. Now, what is premature menopause? Premature menopause is also called as premature ovarian insufficiency, when because of some genetic problems or because of some chromosomal problems or because of something like a hysterectomy where your ovaries also are removed, or because of radiation or chemotherapy which you might receive for any other kind of cancer, your ovaries stop functioning before the age of even 38 years. So if you have your menopause before the age of 38 years is a time of premature menopause. Now, premature menopause and early menopause are both important in what way? That whenever you have early menopause, the effect that estrogen has been, the positive effect that estrogen has been having on your body is kind of diminishing or decreasing. So the estrogen levels in your body are affecting your heart health also, they're affecting your bone health also, they're affecting your digestion also. So if you're having a very early menopause, all of these factors, all of these systems get affected, and you may have problems in all of these systems. So basically, if you say a woman who has had her menopause and a man who's around of the same age have a similar risk of having a heart attack. But if it's a younger woman, who still has her periods and a man of the same age, the woman has a threefold protection because of her female hormones of having a heart attack. So obviously, if this hormone estrogen is getting depleted at an earlier age, all of these risks increase, and that is the time when you definitely need to seek treatment for your early or your premature menopause. There's another entity which we call as surgical menopause. Again, there's a myth that hysterectomy or removal of uterus means I will have menopause. So removal of uterus will obviously mean you will not have periods because your uterus has been removed. But unless and until your ovaries have been removed, you will not face the symptoms of menopause. Because if your ovaries are there, they are still secreting the hormones, and those hormones are still working on your body, and you will not feel the symptoms of menopause till your natural age of menopause. So hysterectomy is not always synonymous with menopause. Hysterectomy will mean a menopause only if the ovaries are also removed along with your uterus when you are having a hysterectomy. And this is a surgical type of menopause that you're having. Now, we spoke about the symptoms of menopause, we spoke about the age of menopause, but how do you actually understand that, how am I going to have menopause, or what I am facing right now, is it menopause? That's a very common question that patients have. I'm having these problems, but is it because of menopause? So how do you know that? So first is your age. If you are around the age of menopause, the symptoms could be because of your perimenopause or your menopause. So when we talk about age, even though you actually get your menopause at the age of 46 years, the symptoms of perimenopause, the time of perimenopause can begin even before. 3 to 5 years could be the time period when the symptoms of menopause start in your perimenopause. So this could mean the beginning of your menopause transition. So all of these symptoms that we discussed earlier, you may feel all of those symptoms or some of those symptoms when you're in this transition phase. Sometimes we also need to do some tests to find out if you are actually in your menopause or not. So if you're maybe 50 years old or 45 years old and you're having these symptoms, we may not advise you these tests to understand whether you're in menopause or not. But if you are maybe 35 when you're having these symptoms, or you're not having your periods regularly, that is the time we may ask you to do certain hormonal tests to understand whether you are in menopause or not, because that is the way we can diagnose early or premature menopause in a person. Now, after speaking about menopause or understanding a bit about menopause, let's come to the management of menopause. How do you manage the symptoms of menopause? Now, when it comes to the management of any disease, it's always lifestyle modifications, and especially these lifestyle diseases, it's lifestyle modifications can help you. And of course, medical management is also always obviously there to take care of these problems. So when we talk of lifestyle modifications, let's see what all can you change in your lifestyle which will help you to deal with these symptoms of menopause. So to begin with, food. Food is like the central thing in anything that we do. All our festivals, food is the central or at most the point of most attraction. Ki khana kya khayenge? So food is really, really important. What goes inside your tummy is something which definitely has a huge impact on how you feel, how you look, and if you're fit or not. So obviously it is important to have a balanced diet, and we all know that. The only problem is that it is difficult for us to actually go and have that balanced diet. And especially when you talk about menopause or the perimenopause transition and the symptoms you face at that time, with all those mental or psychological symptoms that you're also facing, those food, getting over those food cravings is definitely very difficult, and we all understand that. But it is important for you to eat everything, but in moderation. So, a lot of fad diets coming up these days. Ki, acha, weight बढ़ गया, तो, stop having carbs or have only fat and have only protein, leave out all the carbs in your diet. So carbs, proteins, fats, vitamins, minerals, all of this is a part of our diet for a reason. Every food component has some role to play in our body. So carbs don't always just make you fat. Carbs give you energy. Carbs are important for your routine functioning. Fats don't make you fat. Fats are also important for the routine functioning of your body. Fats are important for your body to absorb certain fat soluble vitamins like vitamin A and vitamin D, E, K. That is also an important role that fats play. Water, obviously, it's very important for you to stay hydrated, because water is the elixir of life. And sometimes what we also need to, look at or pay attention to is that you sometimes need to make a certain change in your diet. So very typically people say that, I've been eating the same thing and suddenly I've been gaining weight because of whatever food I've been eating for the last 10 years or 20 years or so on. But sometimes because of certain changes you see around your perimenopause, like the change in fat distribution, like the change in metabolism, like the hormonal changes that you see, it is sometimes important or necessary for us to change the kind of food that you're eating. So one is the change in the food wherein you're eating everything in moderation. Second is also some important food items that you also may have to which will help you to deal with the symptoms of menopause. So what comes in play here is are the phytoestrogens, which are the soy derivatives or the soya, which is just become quite common and quite famous for its natural properties of having natural estrogen in it. So certain phytoestrogens in our diet can be soya, which is definitely a very important source of phytoestrogens. Then other food items, other pulses as well. So something like your chickpeas or chole, then your moong or your other pulses like moong dal or your matki or your black-eyed beans. All of these are also have a little bit of phytoestrogens in them. What else has phytoestrogens are the regular spices that we use. So sometimes it's your turmeric, it's your ginger, which also has good amount or a fairly good amount of phytoestrogens in them. So, all of these spices, which typically are a part of our Indian diet, definitely it makes our diet quite wholesome to have. Of course, everything in moderation is important, and it's not good to have rotis just made of soya flour. So you can add a bit of soya flour in your roti flour, but that doesn't mean that you just have only soya, because anything in excess is not going to be good for your body. Now, going ahead with another lifestyle modification that is quite often not given the importance it deserves is sleep. So, especially with the people, all of you people in these fields, ITs and startups, we undermine our sleep. We don't give it we say, oh, I can, मैं तो आराम से night मार सकती हूँ. You can do it right now, probably, but is it a good thing to do? No, definitely not. What is important is that you get a good quantity of sleep. So 7 to 8 hours of sleep at night is essential for every person. The quality of sleep that you get is also important. Another thing which is important is the time you go to sleep. So if you sleep at maybe 2 o'clock and get up at 7 hours after that, sometime maybe like 10 or 11 o'clock, not really good for your body, because your body, as humans, our bodies are often in sync with the natural clock or the natural rhythm of nature as well. So usually animals or humans are tend to wind down or rest and sleep towards the night and wake up when the sun rises. So if you follow that rhythm of nature, it's much easier for you to get a better sleep, and it's also easier for you to get a good quality of sleep as well. So sleeplessness is also a very important problem that women in menopause or in the transition phase face. So very often when it's like a cycle, a vicious cycle. You can't sleep, then you watch the mobile, and then you can't sleep further. Or if you can sleep because your eyes are so tired, but your sleep is very disturbed. So not having that screen time before you sleep, not exposing yourself to those blue light before you sleep, definitely makes a difference to the kind of sleep pattern that we see. Winding down a little before you sleep definitely helps you as well. So sleep is something which is really important for us, but we don't give it the importance that it actually deserves. Now, going ahead with another lifestyle modification that is extremely important is exercise. So with the kind of sedentary lifestyles that all of us usually have, we don't move around as much as our ancestors used to, or even we as kids probably used to. So we definitely need to take help of some kind of exercise routine. 30 minutes of exercise done daily for at least 5 days a week is something that will definitely help you to stay fit, will help you to stay will help you with a good stamina, will help you to be a little flexible. Another important thing that exercise does to you is it makes your bones and your muscles strong. Now, why is that important? Is because you tend to lose your bone mass even after the age of 30. and this loss of bone mass accelerates towards the age of menopause. So it's important for you to exercise. It's important for you to eat good calcium rich foods, but it's also equally important for you to exercise well for that calcium to actually get deposited in the bones. So here, what kind of exercise helps you is some kind of resistance training or weight training. So typically women will say, oh, women are not supposed to lift weights, and they wouldn't lift weights. But if weight training helps you to build a stronger bone mass as well, or maintain a better bone mass as well. Some amount of bone loss is inevitable, but if you begin with a good bone mass to begin with, it is definitely going to be easier for you to maintain a good mass towards the even towards your menopause. So that is about exercise. Then going ahead, talking about some stress. So I'm sure all of us have a lot of stress in our lives, definitely, and it's really important for us to de-stress in some way or the other. So de-stressing could be with whatever activities you like. It could be a hobby that you are following. It could be something like breathing that you are doing. It could be some me time that you spend with yourself, away from people around you, without being responsible for people around you, without looking at your gadget. That itself could be a way to de-stress yourself, and that de-stressing helps to decrease the levels of cortisol or your stress hormones, and goes a long way in making you feel less fatigued towards the end of the day. And to help, it also helps you with the mental health symptoms that you, or the psychological symptoms that you may face around this time. Then, coming to the, again, going back and talking about why should you know about menopause. We saw that a lot of people don't know about menopause, and let's see some examples of some cases wherein how knowing about menopause helped them or could have helped them. So let's talk about the first example that we have. So let's talk about one Mrs. X. She's 42 years old, and she had been, her job constantly keeps her on her toes, and it's always work, 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 and there's no time for exercise, no time to eat healthy as well. And that is a kind of lifestyle that she's always been following. And now she's 42, and now she feels tired, now she feels bloated, now she feels joint pains, she has that burning at the back of her chest and her throat, and she's always had unhealthy habits, and she says, okay, all of these habits were okay with me so far, but now suddenly I feel the brunt of I feel that I cannot cope up with these habits anymore. And now getting suddenly shifting to a healthy lifestyle, exercising in spite of those joint pains, is getting really difficult. So what Mrs. X says is that if only someone could have told me about menopause then, when I was abusing my body in different ways. So that's why it's good for all the younger people also present here to know about menopause, because how you take care of your body now in your 30s is going to determine how you face your problems or your menopausal issues later on. So I always say that our elders, our parents or the generation above us has always been more resilient, and they have not always had as many problems as we have today. So almost all of us have this shoulder pain, this ankle pain, and heel pain, and knee pain. All of these issues have started. Our ancestors, or forget our parents, talk about our grandparents. Hardly anybody had all of these problems, and they all lived a healthy life. So why did they do that, or how did they do that? Because they had these healthy eating habits, healthy exercise habits from the beginning. Our daddies did not go to the gym and lift weights, I know, but a lot of our daddies actually walked to the bus stand, took a bus. They had that mortar and pestle to grind their chutneys, and a lot of them have also used that. I don't know what it's called in English, that the zata to make their flowers. So a lot of them have done all of these things, which were really, which were almost like exercise. So that is why probably today they did not feel the menopause symptoms as strongly, or as as severely as we do. So it's good to change your habits as early as you can, so that like I say, if you start exercising early and have a good bone mass to begin with, even if you lose your bone mass, you're not going to end up having osteoporosis. You're not going to end up having fractured hands and feet, legs if you fall down, if you have a light fall. So it's really important to start early and to understand that, yes, this is something that's going to happen to me after a couple of years. So it's good for me to be prepared for it. Now let's take another scenario and let's talk about how let's see how other people around us can view us. So let's take Mr. Y. He has his wife. She's 40, and she was always upbeat, and she was always running about. And now he says that I don't know what's wrong with her. She's always so lazy. Keep telling her that you go to this gym, you do this exercise, let's go out, but she just doesn't want to. I tell her not to eat all of that. Let's go on a healthy. Let's start eating healthy, but she just doesn't want to. She just keeps getting more and more anxious and angry at me. So I don't know what's wrong with her. So that's where it's also important for men to know about menopause. That yes, your wife is 40. She could be going through menopause. Now, this Mrs. Y is really lucky that her husband is understanding or at least noticing that there is something wrong with my wife. So if you understand that yes, something is wrong with your partner, you can help her to seek the correct kind of help that she deserves, and not just dismiss her concerns as saying that, oh, she's just being lazy. She is not being lazy because she wants to. She is not being lazy on purpose. Something that is happening inside her is actually making her do that. So it's very very important for even the men in our lives to understand menopause so that they can support us through this phase of life. Going ahead with that, not everybody's husbands are as good, I would say, as Mr. Y. So let's talk a little bit about microaggressions. So talking about the first microaggression, I am sure all of you have seen the movie, what is that? English Winglish. And we've seen how Sri Devi, juggles in her role of homemaker, and and it becomes she proves herself in some way or the other. So there's a scene when he's introducing her to guests at home, and he says that, oh, my wife was born to make laddus. Maybe he doesn't mean it in a negative connotation or negative sense, but she really gets offended. Yeah, I was not born to make laddus. I'm much more than a laddu maker. Very often when I ask women who are homemakers, what do they do? They say, nahi, मैं काम नहीं करती, मैं घर पे हूँ. मैं काम नहीं करती is not the answer. You're homemakers. You're taking care of the house. So this thing that we know they have, it's years of patriarchy. It's years of I don't know, microaggressions which have made women say that, oh, if I'm not working out of home, I'm not working at all. But working, I mean, all of us who work out of homes are doing two jobs. We're working at home, plus we're working out of home. There are some of us who are working only at home, but that doesn't mean they're not, wo kaam nahi kar rahe. They are working. And these kind of small microaggressions, this is my wife, wo kuch nahi karti. This is how home, even men introduce their wives. So this kind of microaggression also really puts us at a point where the people around us don't understand us. Then we could see another example when it's said that, oh, I have we have more helpers than people in our house. My wife has a cleaner, a cook, a driver, a maid, a this and that. Your wife doesn't have these people. You have, as a family, as a house, you have these people. Cooking, cleaning, driving, and mopping the house and all that is not your wife's job. It's your job together as a family. So the moment we stop these microaggressions, when the moment we stop talking about our wives, when men stop talking about their wives in such a way, is when they're actually going to look at them as individuals, and they're going to look at them as people who actually deserve to get a good, healthy, fit life as well. And that is when they're going to help them lead their lives in a healthy and a good way. Now, what the fathers are doing is also kind of passing on to the kids as well. So going to the next slide, we'll talk about the child saying, oh, meet my mom, she's Mrs. Steinbaum, because she keeps getting angry and anxious all the time. So even the kids, they should understand that yes, this is a phase of life. My mom is going through menopause, and I'm going to support her through that, and not constantly pass remarks like, oh, isko to sirf AC chahiye sar pe, and she needs this, and she's a time bomb, and she gets angry all the time. It's not, she's your mom and she doesn't want to be angry at you, but there's something going on inside her which is beyond her control, which is making her like that. So that is also something that we also need to pass on to our kids that they also understand menopause, and so that tomorrow when they have partners, they're going to be more open and understanding to their partners as well, and the other way around. And even if it's a girl, it's important for her to understand so that she is also considerate to people around her, maybe her colleagues who may be going through this problem or this phase of menopause. Then something that's very very often faced by a lot of people around us, and this is gained a lot of this thing in the media also right now everywhere. There's this body shaming. So nobody will say, oh, you're looking fat or you've gained weight. Why don't you try a diet? My body is my body. You don't have to say anything about my body. If I want to go on a diet, I will go on a diet. Probably you never know, right? She's somebody whom you are giving free advice, saying why don't you go on a diet. Maybe she's battling with the issues of menopause and she's unable to lose her weight. She's not, it's not that she's eating because she wants to, she's not worried about her health. She is worried about her health. She really wants to be whatever thin or whatever the shape, whatever figure she wants to be in, and she's trying. But then just saying that, why don't you try a diet, it's not helping her, it's not helping anyone, it's not helping her, it's not helping you either. So it's time we step away from these microaggressions and actually help people around us to really solve their problems and to understand that yes, these problems are real problems and that we do have solutions for them. Now going on to about menopause again. When do you actually go to a doctor? When do you yes, you definitely go to a doctor when you are facing a lot of symptoms, or any of these symptoms that we spoke of, all of these psychological symptoms as well. But when do you actually need to seek medical help? There are a lot of myths around all of these things that I've spoken about. So routine screening is something people are wary of, because मैं test करूंगी तो कुछ निकल आएगा. A known demon or a devil is better than an unknown one. Rather than not testing and not understanding where you are, what is happening to you, it's always better to get tested and understand. Diabetes hai to hai, at least you can take medicines or you can take measures to help treat it and prevent it from further going and becoming severe. So routine screening is definitely important, because this is also the time when you're prone to certain metabolic diseases or lifestyle diseases like diabetes, like blood pressure, like heart issues, and so on, because of the other hormonal changes happening inside your body. When you have unbearable symptoms, typically you are told ki, oh, this is menopause, ye thoda time mein chala jayega. Bilkul chala jayega. It will, it's not going to last for your lifetime. But does that mean that you bear those symptoms for that time? No, it definitely does not. And you are definitely entitled to go and seek help for these symptoms whenever you want. Heavy periods, it's because of menopause that you're having that. It'll last for a while, it'll go away. But while it is lasting, for whatever while it is lasting, you're losing blood, you are getting weaker, you're losing your immunity. And why do you want to get distressed with that heavy flow and the frequent changing of pads and whatever? It is not normal to have heavy or frequent periods around menopause. It is common to have it, but doesn't mean it is normal to have it. If you have it, you definitely need to get treated for it. Then postmenopausal bleeding. It happens, after you've stopped your periods, you can have bleeding on and off. No, you cannot, and you should not. So once you've actually had your menopause, no periods for 12 months, if you have any spotting, bleeding, anything after that, it is definitely something which needs evaluation. So it is definitely a time when you need to go and talk to your doctor ASAP. You will need to undergo a sonography and find out why you're having that bleeding. Your doctor will also examine you to understand why is it bleeding. The bleeding could be because of just atrophy, which happens in the vaginal tissues, which can give rise to bleeding because the vaginal mucosa, the vaginal lining becomes very friable, or it could be a thickened endometrial lining, which could be a precursor of endometrial cancer as well. So it's definitely important to get yourself evaluated if you're having bleeding after you've stopped having your periods. Same applies for post-coital or bleeding after you've had sex. Any kind of such bleeding again can be because of the friable vaginal mucosa also, but it also could be because of some cervical lesions, which would be again precursors of cervical cancer. So definitely any kind of bleeding after you've had intercourse, honestly in any age, definitely requires some gynecological examination. Recurrent UTI. So very often people keep getting UTI and they say, oh, I travel a lot, so I use a lot of public toilets. That's why I get UTI. It's a myth, ladies. You do not get UTI by using public toilets. When you use a public toilet, none of your parts of your vulva or your urethra or your vagina, nothing is touching the pot. So there is no way the microbes can, zoop travel from somewhere and attack you and your urethra. So using public toilets will not cause recurrent urinary tract infections. In fact, very often if people are traveling a lot and they avoid using public toilets, they kind of don't go to the loo for such a long time that the urine stays inside the bladder for a very long time. And that stagnant urine and drinking less water because you don't want to use public toilets, that is what actually very often leads to urinary tract infections. So it's not always, you cannot have UTI because of using public toilets. Sometimes this recurrent UTI can be because of vaginal dryness and the urethral dryness and the urinary system mucosal dryness, which happens because of menopause. And that could be the reason of that recurrent infection, which has to be treated in a way different than just giving antibiotics to treat the infection. Then again, mental health issues we spoke about, that people feel that, oh, this is something separate. You can't have depression and menopause. It's not related. It is related. And definitely you can have all of these problems with your menopause, in your menopausal or your perimenopause or a menopausal transition, and definitely important to seek help for it. Then, to conclude, so what can you do to help somebody who's probably going through this menopausal transition? First thing is awareness. Like we saw in the video, people don't know what menopause. If you don't know what is happening to somebody, how will you help her? So first is understanding or being aware of this entity of menopause and that it can cause all of these problems. Support, understand her, understand and give her the support in whatever way she wants. If she is having heavy bleeding and if she wants a leave on her period, it may be that. But just giving leaves is not the only solution. Probably she wants help in some other way, support in some other way. So understand where she wants a support and give that support to her. Be empathetic. Don't judge somebody. Don't say कि हाँ इसको तो ऐसी ही लगता है. She's not doing it on purpose. So be empathetic. Don't label her with someone who always keeps feeling hot and always somebody who's a time bomb probably. Don't be like that. Don't judge. Be empathetic. Provide her help. Sometimes, just listening to someone helps solve their problems. Sometimes women don't have anyone to speak out their problems to. So maybe you can just give them that listening ear to help them understand, to help you, so that they can tell you what they're going through. And that also sometimes can make you feel much better. If she wants professional help, definitely help her seek that help. Sometimes it's not always easy, for a woman to get out and go and talk to a concerned person. I'm having these problems. Sometimes she just needs some kind of support to go with her and help her in that. So whatever way she needs that help her. Like